afternoon, everybody. Thank you for joining us today. My name is Victoria Corner and I'm the Research Portfolio Manager. I'm going to talk to you today about research at Hampshire hospitals and how we can support chief investigators to develop their research ideas. This can be anything from a simple one-site questionnaire study or something more complex, collaborating with the University of Winchester and other external partnerships. It may be a study that requires no or minimal funding or a grant application. We can always start small. We now have in post Roxana Andreska, our R&D business manager, and starting in June will be our study support coordinator. And so our team is growing, which enables us to support our clinicians and their own research more. Why is homegrown research so important? Natasha, our head of R&D, spoke this morning about her vision for research at Hampshire hospitals. Building research capability and empowering staff to be involved in research is key. The pandemic over the last 12 months has highlighted how research can be at the heart of patient care, and we need to build on that. But where to begin? It can be daunting. So begin with a literature review. Your research question needs to be unique. Define your question. It needs to be a good question, clear and meaningful. Your protocol should be peer reviewed by an impartial researcher. Where possible, have PPI, public patient involvement, volunteers who can provide valuable input. Then funding. Once you have a study design, we can help cost the study and see if there are any funding streams we can apply for. Sources of help. Hampshire Hospital Library and Knowledge Service, now based inside the Marshall Rose Library at the University of Winchester and at the Ark at Basingstoke. The Research Design Service, free service funded by the NIHR, providing a wealth of knowledge and experience. And then we have put together our R&D researcher pack with useful links and documents to guide you. The library can support you with a literature review to ensure you know what research has been completed and that your research question has not already been asked. In the R&D researcher pack, there is a form to complete for a peer review, and we can also ask the CRN to help us find experienced impartial researchers. We can help guide you with the IRIS application and submitting the necessary documents to support the study when applying for ethics and HR approval. Even the most simple research study has a cost, so where possible, we'll always try to find a small pot of money, be it a charitable fund or small funding stream. We can advise or signpost to who can help when applying for funding and finding those funding streams, help with application forms or costing your proposal. And then eligible studies can apply for NIHR portfolio. Accruals from portfolio studies contribute to meeting our annual NIHR recruitment targets. At Hampshire hospitals, we'll be recruiting volunteers into the role of patient research ambassadors this year. These ambassadors will help promote research within the trust, but can also provide input into our studies. Their experience will provide a crucial viewpoint. And we can do this through online focus groups, reviewing documents, or being part of a steering group. By sharing their experiences, their knowledge can help shape the design of a study by giving feedback to questions like, are there too many extra visits, questionnaires, or tests? Would they take part in research? What would put them off taking part in research? What would be the advantages of being involved? What were their key priorities when they had treatment? Wording of the patient information sheet. A patient's experience can inform you on how they felt on reading the PIS. Was it too clinical? Did they understand everything? Subtle changes can make all the difference. And then lastly, all studies require a sponsor. The UK Policy Framework for Health and Social Care Research is the policy framework that sets out good practice in the management and conduct of health and social care research. It is a framework that provides guidance on all stages of the conduct of a study, and so an important document to refer to. The sponsor is the individual organisational partnership that takes on overall responsibility for proportionate, effective arrangements being in place to set up, run and report a research project. This is ensuring the research is well designed, with a suitable research team, clear delegated roles, ethically approved, with adequate finance, management and reporting of the project. If you would like HHFT to sponsor your study, we have a request sponsorship form and a risk assessment form for you to complete and submit with your proposal. And the risk assessment form will ask questions about the level of risk the intervention has to the patient, the informed consent process, what data is being collected and how it is processed, stored and transferred, as well as are the key outcome measures sound, how will the data be analysed, and are the IT systems secure? Thank you for your time.